Hi everyone, my name is Lauren Colley, and today we are going to be talking about adverse childhood experiences, or what is better known as ACEs. So what exactly are ACEs? According to the Centers of Disease Control and Prevention, adverse childhood experiences are potentially traumatic events that occur in childhood, which they define as between the ages of 0 and 17 years old. These ACEs can be identified as violence, physical abuse, emotional abuse, physical or sexual abuse, neglect, alcohol, substance abuse, divorce, incarceration, or mental health problems. In turn, all these different situations that a child could find themselves in can cause an increased risk of injury, STIs, maternal child problems such as early pregnancies or miscarriages, increased risk of chronic diseases, and low SES standards, mental disabilities, relationship insecurities or troubles, suicide, involvement in illegal and wrongful activities, and the list keeps going on and on. So in order to watch out for ACEs and help the children around us, we first need to know how we can actually spot when a child is suffering through ACEs. The Health Watch organization, United Kingdom, included these potential signs of ACEs: mood swings, depression, suicidal ideation or attempts, anxiety, PTSD, weight problems and eating disorders, risky or illegal behavior, and early sexual activity in pregnancy. Now, I've had my own experience with ACEs, and for private and personal reasons, I will not be going into much of the scenario, but I was working at a clinic and I was told that I was not allowed to help this certain individual because they did fall under a certain regulation that did not allow internships to help. And needless to say, I was in shock and I felt so terrible because I put two and two together and I knew what was happening, but I felt so useless at the same time. And I just really think everybody needs to be aware of these things because we can help people and we can help stop it, which ACEs has been known to affect children and in their childhood, but also when they're adults with the same different consequences that we talked about earlier. So now that we know what ACEs is and how we can look for it, what can we do to prevent it? The CDC provides a well-detailed list of ways to prevent ACEs. We can strengthen economic support to families, that having more family-friendly policies in the workplace, build public campaigns against ACEs and other domestic forms of abuse, kind of bringing up awareness and making people more aware of what's happening and how to deal with it. Provide an equal and strong start for all children, especially within the educational system. This is so important because children who go through ACEs often will decline in an educational background, and that will affect their future. So if we can go ahead and get them a strong foundation within the educational system, they're more likely to prevail and do really good when they're adults. We can also support and connect with after-school programs or mentoring, like the Big Brother program has been very successful with helping children who go through ACEs. And last but not least, we need to, if we see something, we need to say something and we need to do something. Most of the time, children aren't aware what they're going through. They think it's normal. They think that it's their fault and they're not going to say anything because they're scared. So if we see something, we have to say something and do something because it is our responsibility to help them. And together we can prevent ACEs and change lives. And those are my resources. Thank you.